Hi, I'm Dr. Zarif. I'm a bariatric surgeon at Atlantic General Hospital. I'm here to talk about lap band and morbid obesity and surgery as an option for treatment. Morbid obesity has become epidemic in this country in the last couple of decades. The statistics, 1 out of 3 people in the United States are morbidly obese. That's the reason why options of surgery have come to become more common and popular nowadays. The progression of obesity over the last three decades in this country and in westernized countries contribute to multiple factors. Cultural plays a major role. Lack of exercise, the explosion of fast food, all contribute to the problem. We measure obesity by something called body mass index, which is your weight, the weight over the height. Give us a number, and that number important because is indicate if you are a candidate for surgery or not. The body mass index should be 35 and above for anybody to be qualified for the surgery. Why it's important to address this problem? Not only because it's an epidemic, because the impact on health and financial issues. Health, we know that's when the body mass index over 35 carries a high risk of developing medical condition and comorbidities, from diabetes to high blood pressure to sleep apnea. Every single organ in the body affected and at higher risk of developing conditions when the body mass index over 35 and the person is obese. The financial effect is well known, and the study shows that in an average $20,000 a year individually spent on a problem associated with obesity. Again, it's multifactorial. Genetics plays a role in it, and culture plays a role. The lap band is a minimally invasive procedure, carries the least risk of all the gastric, the obesity surgery. It's done as an outpatient. 99% of patients goes home right after surgery. The risk from the immediate risk and the late risk from the surgery is very minimum. It is reversible, and the success rate is comparable to other modality. The lap band surgery require compliance after, and that's a major stone in your success of the surgery, is to be compliant. Require multidisciplinary approach to it with nutrition support, diet support, psychological support, and follow-up. Follow-up needed for adjustment where the patient comes to the office frequently the first year, every 4 to 6 weeks maybe, and get an adjustment of his band to get him to the right fit or right zone where we start seeing weight loss. The average weight loss from the lap band the first year is between 50 pounds and 100 pounds. There is always risk carries from any type of surgery, and this is no different. Lap band has some risk into it, including risk from the surgery itself, risk from slipping of the band, something called band slippage, which may and may not require surgery. Overall, to be a candidate for surgery, you have to meet the weight criteria. You have to meet some requirement of nutrition, attempt to lose weight through diet. In our program, we offer all the support you need to succeed in your journey: nutrition support, fitness support, and psychological support.